Hey, what's up everybody? It's Zack McCarley. I'm over at Dr. B's office. Just came back from Kennewick, Washington. I hit an 8-10 yoke. Unfortunately, I popped a rib directly out, and it's pretty tough. I can't really get a full breath in. It's a pretty common yoke injury, but I called into the clinic directly from Kennewick, and luckily Dr. B was already here, so I was able to come in. And this is actually his day off, so he's really giving me the special treatment. But a rib is something you don't play with. You got to get on injuries really fast. So let's let's do it. I can't even breathe.
Let's go face down. First things first, we're going to go through our initial myotome assessment. Bend this knee, hold, bend this knee, hold, leg up, hold, leg up. Hold this leg up again, hold, and we've got weakness in the right SI. Leg up, hold, leg up, and hold. He's good there. So let's see. The lower ribs.
Yeah,
left side.
Right there, yeah. You went over it. It was up a little bit.
Let's start here. Anything on the spine?
No pain.
Not too bad.
A little bit at the upper end that you did on the spine.
Oh, in here?
Yeah, a little bit right there.
Oof, oof, oof. Lower ribs are tough. They're floaters. And so we're going to start right in here. Is she okay with this?
Yeah.
Okay, let's go to this other side here, balance them out. So he's good on rotation. Let's go on your back. He's got some pretty significant paraspinal spasming, which will need to be treated. So let's run through our myotomes. Bend the knees up and squeeze. Good. Legs down. Hold here. Good. Toes up. Hold. Bring this foot in. Hold. Bring this foot in. Hold. Push in. L4. Make our correction. Bring her in. Good. Bend this knee. Pull down. Push up. Push here. Straight leg. Hold it up. Hold. Very nice. Bend the knee. Pull down. Good. Push up. Good. Push. Good. Straight leg. Hold. So we can see weakness in the L4 myotome in the left hip. Definitely, if that fails, that's going to load the heck out of that rib. Let's go right here. Good. Got that taken care of. Leg up. Hold. Hold. Good. Foot out. Hold. Turn it in. Hold. Good. Up. Turn it out. Hold. L3. Turn it in. Hold. Lay on this side. She okay? Drop this back. There it is. Let's go on the other side. The ribs originate at the spinal level. If the spine subluxate, you can get the ribs to pop out. And in this case, we adjusted that segment. Let's drop this right back. Oh boy, she's a top one. So we're going to do a magic trick. Flat on your back. Flat on the back. Double ribs coming up. Let's go with the cross. We're going low. Tuck your chin up to your chest. Let's get you right up in here. There it is. And we'll go one more right up top. There it is. Nice. Okay, now the muscle portion on the back, you can feel as the errector. Turn over. So we'll do a few passes through that. Well, actually, yeah, go ahead. How's it feel now?
It's easier to breathe, but I can still feel that muscle.
So the muscle that we're going to start with the errector spinae.
It's right there, right over where your hand is.
Right over here is going to be the serratus posterior inferior, and we'll treat that seated. But we're going to start basic paraspinal treatment. Let's just start right in here. Get this out. There's a release. And we'll do one more. Okay. To hit the serratus, we'll have Zack sit. Come on up. Alright. We'll cross your arms. So these muscles kind of go obliquely across the spine. So what we'll do is let's lean back on the knee this direction, and then we'll go. Yeah, it's pretty spasmed. And let's do one more pass. Go. Good. It's pretty good for that. Let's test it here. Hold. Let's give a twist. And hold. Good. Twist. And hold. Good. Breathe in. Hold. Exhale. And hold. Good. Laterally bend. Hold. Laterally bend. Hold. It's weak and left lateral bending. Cross the arms. So we'll go ahead. Bend left and to the right. This resets the nervous system, calms down spasm, and helps restore normal movement to the spinal segments. Yep, let's keep working that up. Right there. Let's retest. Laterally bend it and hold. Good. Reach forward or lean forward, hold, lean back, and hold. It's good. Next thing, we get the laser on it.
Alright.
Let's do it. During an acute injury, it's critical to, one, get the joints adjusted back into proper alignment. Two, try to minimize muscle spasming. Three, reduce inflammation and promote tissue healing. With laser, we can speed up the healing process. I'll describe how the laser works as we're treating. This is a class 4K laser, which is a high-powered, low-level laser. It has 12 watts of power, and it uses multiple laser beams to stimulate a photochemical response. And essentially what happens is it's healing at the cellular level by stimulating the mitochondria to produce more ATP. More ATP is going to result in decreased pain, more cellular energy so the body can heal and recover. And we always like to recover and heal faster.
Yay, recovery.
Yay, recovery. So here we're working through the area where Zach's feeling the muscle strain. We also note there's some inflammation. So this is going to be a really nice way to stimulate a healing cascade in this injured area. He'll want to follow it up with his ice protocol, and we'll definitely want to treat it again tomorrow. As you can see the laser, well, there you go. Right now it's at a pulse setting. The pulse setting allows the laser to penetrate deeper into the tissue so we can get down into the joint, the disc, and then it will also cycle through and go into a continuous setting where the laser will not be blinking, which will provide the laser to the superficial tissues, helping with inflammation and tissue recovery. Now, not all lasers are the same. Majority of the therapeutic lasers in the market are low power, but we prefer more power. Now it's on an intense super pulse, which goes even deeper. This is going to get into the disc, the joint capsule, the facet joint, all of which are involved in this type of injury. The laser is also important because it can also be used as a diagnostic tool to determine the severity of a tissue injury. Laser is not indicated for every type of injury. If there's a fracture or if there's bleeding, a lot of deep muscle tear, muscle bleeding, the laser may actually be painful, which indicates that we've got a severe muscle tear and it's going to need to be treated in a different fashion. This is a good sign that Zach's able to tolerate this laser, which indicates it should heal up relatively quickly. Now you can see it's going through a continuous. The provider, the technician, is going to need to move the laser a little more quickly as it's quite hot if it stays in one position. So we're using a painting technique to provide laser throughout the entire area that's inflamed. And this typically feels good to the patient. How does it feel, Zach?
Nice and warm.
Nice and warm. One of the things we found that the L4 myotome was weak, so we always want to make sure the ankle is correctly moving through its range of motion. So we're going to check. Oh yeah, you can feel she's locked up. Alright, so one, we've got a talus. Let's check his calcaneus. So he's good there. Talonavicular joint. So we'll bring this. Got it. Very nice. We'll post check it. Alright, now let's check this cuboid. He's fine there. And let's go through. Metatarsals are good. Calcaneus, let's distract. There we go. Good. Alright, so we've taken care of that. And we'll move up into the knee. Foot up, turn the foot in, hold, good. This one up, turn the foot in, hold his knees out. Posterior tibia. So we'll contact behind the tibia, flex the knee, got it. Right here, foot up, in, good. And then we'll check for laterality. So we'll go here, straight up, good. Turn the foot in, push up, turn the foot out, push up. He's good. Okay. So this is called a prone leg check. If we look, we can see his left leg is longer than the right leg. Can you see that?
Yeah.
Now the next step is we go up to 90 degrees, and if we look this way, we see the short leg has now become longer. So next step, we drop it down, and that's not bad, but he's got a torqued pelvis. So what we do is we utilize our drop table. One more. 3 drops. And we can check again. Leg length levels out. Next, we'll go through our advanced disc rehydration technique. This is painful on the back. Let me know. Are you okay there?
Pretty decent.
Okay. Since we like Zach, we'll use an advanced technique that helps with inflammation, increasing movement, relaxing the muscles. Drop this table like so. The strain is on the left side of the spinal column, so we're going to stretch it to the right to elongate. There you go. Is that all right?
Yep.
You can also use vibration as a diagnostic tool. If there's a fracture or a broken bone, it will hurt severely with vibration on it. You okay there?
Yeah.
Take her over to the left side. Is that alright? Yeah. Is that pinching?
You kind of pinch it a little bit.
Now, since Zach helped me so much with my one-armed dumbbell press, I'm going to add some additional bonus treatment in here. So, another nice thing, especially if you have a table like this, is we can have Zach right hand grab right here. Remember this? You can squeeze this little lever.
Yep.
We'll start here, and you'll arm back. We'll pull the headpiece over to and reach up and over, and we're going to work through that muscle, elongating it. So we'll start right here.
Palm up to down.
Yeah, perfect. Go ahead and take her across.
QL, right?
Yep, QL. As he goes through the movement, we'll look and you'll feel where the restrictions are occurring, and you may change your line of tension or direction depending upon where you feel the injury. Good. Let's bring her back. Work our way up. Go ahead.
A little bit of nastiness in there.
He's got a little bit. The key is he came in early. This is going to heal up much faster and more efficiently since we've started treatment immediately. If you delay and wait to get treatment, that's when scar tissue sets in. That results in weaker and less elastic tissue, and you'll be more prone to injury.
And why suffer?
Yeah, why suffer? Let's do a couple more passes and we'll go a little deeper through here. Acute injury don't necessarily go as deep as you typically would with a chronic injury, but when dealing with strongmen, sometimes you got to go deep. Go a little deeper through here. Go ahead. Good. Okay, come on up. That's how we do it.
So Dr. B and I hit some dumbbell pressing the other day, and I think it's only appropriate that we show our bruises. I'm going to show mine first. Got a little bit of yellow right here, you know. Little bit, you can't even see it. Can't even see the yellow over here, you know. I guess I'm a little conditioned for it. Let's take a look at Dr. B's real quick. Let's see.
Not too bad.
What's your assessment on those, Doc?
That would be acute contusion.
Subdermal hematoma?
Minor. That's nothing. Doesn't hurt. Ready to do it again.
Good stuff.